So do you remember last Christmas, Santa, he brought Shigella to some bad people in Portland, mainly in the homeless community. Yeah, let's take a look at that. Shigella for Christmas. Let's watch this video.
I spent Christmas at Providence Hospital. This is not a game, right?
An illness is spreading in Portland's Old Town neighborhood, and it's sending some people to the hospital. That is our top story here at 4 o'clock. Thanks so much for joining us. I'm Brittany Folkers. The Multnomah County Health Department is now warning those who live and work in the area to take caution. As Blair Best reports, homeless people are among those most at risk of catching it.
For people living on the streets of Old Town, staying clean is a full-time job.
It is pretty overwhelming. You gotta juggle all that, you know.
We just hope to God that we either have wipes.
And now more than ever, late last week, the Multnomah County Health Department issued this public health warning after increased cases of an illness called Shigella were found in Old Town, including among those living outside and in shelters.
I got it. It was awful.
It spreads through fecal matter. Symptoms include fever and vomiting and can last 3 to 10 days.
I spent Christmas at Providence Hospital. This is not a game, right?
Michael found out he had Shigella after checking himself into a detox facility.
Then when I went to Fora Health, I couldn't hold any food down. It's gross, but soiled my clothes. It's disgusting, right? To the point where they weren't medically equipped for it.
They sent him to the hospital.
And I spent December 20th through Christmas on an IV antibiotic, right? 8 hours at a time. I couldn't even leave my room because it's that contagious, right?
County health officials say Shigella spreads very easily. Even a small amount is enough to make someone sick. So if you live or work in Old Town, wash your hands often and remove shoes before going inside your home or tent.
Or even just sharing a cigarette with someone that you don't know, right? Yeah. Sharing a vaporizer pen, if it has fecal matter on it and you ingest that, you get that infection, right?
And Michael's not alone. We found others sick with similar symptoms.
Side effects, fever, fatigue, vomit.
I was just puking and just going to the bathroom.
It is tough for folks outside when there's not access to clean bathrooms.
Now, one way homeless people try and stay clean out here is by going to the Behavioral Health Resource Center. Here off the corner of Northwest 5th and Gleason is a white van where they hand out tickets for people to use the hygiene services there.
Go over there so you can have a healthy place to kick it for a second.
It's a service many are now coming to rely on.
Take a shower, try to get new socks, keep myself cleansed as possible.
Now, if you think you have Shigella, you're going to want to get tested, and you can do that by going to a local clinic. In Northwest Portland, Blair Best, KGW News.
All right, so we watched that video because Portland's on the cutting edge of Shigella and the homeless encampments, but now Santa Clara County in California, they're addressing Shigella spreading in their homeless camps. Yeah. And you know what? Everybody always says, yeah, but, Shigella's always out there. It can always happen. But what's happening is you've got members of the, gay homeless encampments that are having sex, and that oral fecal matter it's spreading, and it's super, super contagious. So I don't think Santa Clara County is as prepared as Portland was, because Portland seemed to know what was going on. They just picked up on, it's just a little case of Shigella. That's what we're doing. So here's one line. What's concerning about this outbreak isn't the absolute number, the actual number of people. We do regularly see Shigella cases, and they are out there, right? Dr. Monica Roy, Assistant Health Officer in the country's public health department, said on Tuesday, what's concerning more is the number that are related to each other. Related to each other. Yeah. Well, they came right out and said in Portland, hey, if you're having backdoor sex, make sure it's clean, because we've got this Shigella thing going around. And you heard what the young man and a couple of the young men there were saying was, this isn't something you want to get. It's terrible. The symptoms are horrible. Some awful, awful diarrhea. It can be cleaned up. You get antibiotics, and if you're a normal, healthy, functioning human being I understand, it might be in your system for like 10 days where you've got the really bad symptoms, but a normal, fairly healthy individual is going to be able to withstand it. But when you've got drug addicts that are homeless, that are not washing their hands, and they're having sex with a lot of each other, as happens, because, that's why we've got concern. What's concerning more is the number of cases that are related to each other. And they're like, why is that? Yeah, I can't really wrap my head around that. But that's what you've got going on. So is California, are they going to recognize this and go, oh, hey, here's what's going on? And then immediately send out a health notice? Now, when I read that health notice, the butthole word was used. Maybe that'll jog your memory on this topic. Yes. So Multnomah County literally said, you need to make sure that word that I just stated, I don't want to say it too many times because, just don't need to talk about that. We're not talking about a baby who we're cleaning up their diaper. These are adults that got some cleanliness issues. And this is why you shouldn't let people just live willy-nilly wherever, because this kind of highly contagious disease can just, boom, go through a community like that isn't washing their hands the way that we're meant to, or using regular facilities. And guess what? That's why you can't have people just living willy-nilly doing shenanigans all day and expect things to be okay. You can't. So I find it interesting that San Jose and Santa Clara are like, wow, this is really interesting. This is an interesting take on this. So here's what Santa Clara is doing, specifically San Jose. To prevent Shigella from spreading, San Jose is increasing the number of portable toilets and hand washing stations in both locations and cleaning the stations regularly. The city will also supply drinking and washing water. The county public health department has deployed teams to pass out test kits to suspected encampments and for continued testing. We'll continue to follow any guidance or direction from public health or the authorities and experts on this and provide any services and support that our unhoused residents need to ensure their safety and the safety of the community. Now, one of the other things is here it is. San Jose Spotlight. The county is testing people along the waterways for the disease. Of those with confirmed and suspected cases, the majority were not living along the river. However, they have not tested the rivers and creeks to see if there has been contamination. Well, that's comforting, right? Now, you're seeing this pop up in areas all over the United States. You'll see little stories blip up and down. And this is the most recent one that I have seen here on the West Coast since the Portland one. I can't remember how many people Portland had infected. Was it like close to 100? I think it was 80 plus. So, I mean, this goes around. It's a bacteria infection and, it's from fecal matter and however you get that. And one of the stories I was reading, they were saying, well, like the one kid was saying, he was saying, if you smoke a cigarette with a stranger, okay. Yeah. Stranger danger, right? Isn't that something where, if you're not sure the person that you're talking with, you don't, oh, hey, here you go. Here, have a smoke. But in these communities, you do. You share everything oftentimes, right? Yeah, including other human beings. And then you end up, passing that little scooch of Shigella and everybody gets it. And then it's all bets are off. Porta potties are just blasted out for days. It's gross, right? It's really hardcore. But this, and the reason I always bring up this when there's an outbreak, this is just kind of one more of those reasons where you can't just let people live willy-nilly wherever, because the health impact, not only to the people that are experiencing this outbreak, but the community in general. I mean, it does spread. It's going to spread. Highly contagious, right? Somebody with it gets on the metro, gets on the bus, gets on the subway, gets on the whatever. Yeah. And health officials are like, we can't really figure out why this is happening the way it is, but I don't know. We'll just work with that and love our fellow human being. It's because you've created a situation where you've allowed people to just live wherever and in a tent on the side of a street in a big public city. You're not supposed to have porta potties everywhere. It's not how this game works. You know what I mean? But we try and ignore it and go, you know what? Those people in the tents, the urban campers, they're fine. Well, this is one of those reasons why they're not fine. Yeah. And so Sean, what would be your solution? All right. Well, my solution would have been preventing this from happening in the front end. You don't have homeless people living just wherever the F they want in other areas, in other states, in other communities. You don't have to have that. The community shelters are not good places in a lot of these big West Coast blue run cities. They're horrific because you got all kinds of drug addicts that are, that are seeking shelter because you've allowed that to happen. You've said, hey, we'll take care of you. We'll hand you out a tent. We'll hand you out whatever. And then they end up going into the shelter system. And you've just got this huge convoluted issue. My solution would be, don't tolerate just ridiculous amounts of homelessness in your community. But then we're not being compassionate, Sean. Well, is letting people get Shigella out on the streets and have no toilet, like the guy said, I'm going to try and get some clean socks. And yeah, I pooped my pants. I mean, is that compassion? You want to just, our version of compassion has a lot to do with taking a number 2 in your pants. Yeah, that's compassion for us. No, it's preventing people from making terrible choices, which is I can just pitch a tent wherever, go have a bunch of sex with, Bob and Joe and Fred. And yeah, then we're all going to share a cigarette. And if somebody has Shigella, not to let that kind of thing happen in the first place. Are you going to have bacterial infections? Yeah, I mean, you are. But this one to me is not entirely preventable, but for Portland, at least, it was kind of a showcase in, all right, here's that bad thing. Here's one of those, that bad thing that can happen when you have a big community of homelessness get together and, live that homeless lifestyle. This is what it ends up in. An outbreak of a bacterial, fecal matter, hand to mouth, whatever else to mouth, kind of outbreak. It's gross. It's gross. And it shouldn't be happening, but it is happening because we've tolerated these circumstances that literally create the petri dish of this kind of thing being a reality in 2024. This is like some kind of medieval disease, right? Yeah, I mean, it just, Shigella, what's that? Yeah, this is one of those that in 2024, because people are living in medieval conditions. Yeah. All right. That's it for me on this one. Thanks so much for being here. I'll catch up with you on the next one. And maybe we won't talk about, such a topic. See you then. Bye for now.